Let's break down Medicare in Massachusetts and what your choices are and what to pick when it's time to come into Medicare to make sure that we get it all right. And Medicare is actually fantastic coverage. It works really well when we do it correctly. And one of the great things about it is a lot of it is standardized, meaning they've made it exactly the same from company to company, from state to state, just to make it easy for you to make your choices. But not in Massachusetts. Massachusetts has decided we can do it better. And the problem is, they really didn't do it better. They made it much more complicated, gave fewer choices, fewer access. It just made it more difficult because you live in Massachusetts. But we still need to understand this. We need to know exactly how to find the best plan coverage that's going to work for us as we go along. So I'm going to go through Massachusetts choices right now so that we understand them. And I'm Keith Armbrecht, founder of Medicare on Video. I help people across the country make Medicare choices. Takes a little more help in places like Massachusetts, but we're going to figure it out. I'll show you exactly what the options are and really what I would choose if I were choosing my Medicare plan right now in Massachusetts, just so that we get it right. Because once we get it done, we don't want to think about it anymore. We want it to work exactly the way it's supposed to work. And that really is how Medicare functions. It might be the best government program out there where it does what it's supposed to do as long as we get it right from the start. So when we come into Medicare, we first understand you may have watched a ton of videos already and you've heard things like Plan G and Plan N and Plan F. They don't apply in Massachusetts. Massachusetts has their own setup. So I don't know why they would do it. Anybody that's in control in Massachusetts, please bring us back to what everybody else does with Medicare. It just makes things so much easier. But when we come into Medicare, we have that first really big choice. Do you stay with original Medicare with a Medicare supplement plan, or do you choose to go into a Medicare Advantage plan? And if you've seen any of my other videos, you know I am no fan of Medicare Advantage. I just do not like losing control of my healthcare coverage and giving it to an insurance company. That's exactly what it is. A Medicare Advantage plan is a privately run plan. You see the commercials on TV all the time. It takes you out of original Medicare, puts you in control of a private insurance company. Another thing I would not want a for-profit company making my decisions on my health care going forward. It puts you in control with a for-profit insurance company with Medicare Advantage, and then it has networks of doctors, networks of hospitals, has things like referrals, pre-authorizations where you have to get permission to get things done. Original Medicare doesn't have any of that. Original Medicare, you can pretty much do anything that's needed to be done as long as it's medically necessary. If your doctor says you need it, you agree, you don't have to ask for permission. It gets done. The doctor does not have to then put it on pause, go get permission to get it paid for, and then come back and say, okay, now we can go ahead weeks later and do what we should have done just when we started. So original Medicare for me is the way to go. And then again, it comes down to having a Medicare supplement to cover the things that original Medicare does not. And again, it's not complicated, but it's a little tougher in Massachusetts. So let's go through it right now so we understand that side of it, the Medicare supplement part. And that's what we do. We help make sure we get the right one put in place. That's how I make my living. Whatever supplement we choose, that company pays me a little bit to be your service agent now and in the future. So if that's the route you're going to take, hopefully you'll allow us to help you. We'll make sure that we get it right. And that way, again, we don't have any surprises down the road. Now, if you watched a bunch of other videos, you see a bunch of people, myself included, talking about Plan G, Plan N, how great they are. They cover just about everything. There's very little out-of-pocket costs. Plan F, if you were in before 2020 when it was available. Again, in Massachusetts, it's just not quite the same. It's kind of close, but there's 3 options. And really only 2, because one of the options is similar to Plan F, where you have had to have turned age 65 before 2020 in order to be able to get that plan, Plan 1. So you have the core plan, Plan 1, Plan 1A. So they think, wow, that's going to be so much easier than G and N and F, and it really isn't. So when we look at what we have with a core plan, the core plan is similar to what would be a Medicare Supplement Plan A. And I can tell you, I have been doing this a long time. I've never seen anybody choose Plan A. It just generally doesn't make sense. Number one, from a cost standpoint, the premium that costs And then from a coverage standpoint, it has too much out-of-pocket expense. So Plan A really is not a choice that we're going to be looking at. So what that does, it really brings us down to one choice, and it's going to be Plan 1A for our Medicare supplement. So Plan 1 is going to be similar to Plan F. So it covers pretty much 100% of everything. And again, they did away with that kind of plan for people that didn't turn 65 before age 2020. So if you did turn 65 before age 2020, you could get Plan 1 in Massachusetts. But still, it's probably not going to make sense from a cost standpoint. But our plan in Massachusetts is Plan 1A. Plan 1A is similar to Plan G. So if you watched other videos, and again, mine included, Plan G is pretty much Plan 1A. Why they went away from this whole standardized thing and did their own, I don't have any idea. But Plan 1A is great coverage. That's the good side of it. It's fantastic coverage. It has very little out-of-pocket expense. Once you have it, your only cost out of pocket for the year is the Medicare Part B deductible. Right now, that deductible is $257 a year. It's an annual deductible. So if you get hit by a bus anytime during the year, it's going to cost you $257. Then the plan's going to pay 100% after that for the rest of the year. Come January 1, it resets to where you have that out-of-pocket Medicare Part B deductible, and that's it. So again, it's fantastic coverage, but it still limits us in choices. So you can see here where now we really only have Plan 1A to choose from. We really don't have a Plan N to choose from. And you've seen certainly videos on Plan N where it's a very viable option in a lot of places that can lower the premium and still give very good benefit. But we don't have that choice in Massachusetts. We pretty much have Plan G, which is Plan 1A, which sets us up in a way that we have fantastic coverage. Now, another good side, bad side, Massachusetts, they put a lot of other rights on your behalf into this insurance world where when that happens, it just makes premiums go up. So what they've done in Massachusetts is they've made it so it's year-round open enrollment, meaning you can get into your Medicare supplement plan anytime that you want during the year. You don't have to do it right when you turn 65. You can come in at any time without any medical questions and get your coverage. And what that does, again, it really skyrockets the premiums. It almost doubles, might even double the premium going in to Massachusetts. But it does give you protections and rights. So if you get a rate increase down the road, you can change to another company and get a lower cost. So we want to certainly shop it around every year, make sure we have the best value at the best time as we're doing this. We want to take advantage of the rules that they give us, even though it's going to raise our costs, and especially because it's going to raise our costs, we want to maximize the value out of that situation. Now, one control that they do have on that, so that you can't just jump in later down the road when your house is on fire and you need fire insurance, is you need to have, if you're going to come in to a Medicare supplement plan, you have to be on a Medicare supplement plan, or you may have a 3-month wait going into a new plan. So keep that in mind, that if you don't get it right in the beginning, you can get it later. There could be a waiting period before coverage kicks in. And another nice thing, if you come in when you turn 65 or right when you start your Part B, when you retire, like most people do, you'll likely be able to receive a 15% discount from an insurance carrier going forward. So certainly makes sense to come in when you're supposed to come in, and not, some people will try to play a game and make it work in their favor, and sometimes it does, but sometimes, again, with that waiting period, it can be very complicated and might make things very expensive if things go wrong quickly. Something else to understand in Massachusetts, which this can be a good window or a bad one, depends on how you look at this, is the rates are community rated, which means it doesn't make any difference how old you are, male or female, everybody's going to pay exactly the same price for the Medicare supplement plan. So the ones that are older think that's terrific. The ones that are younger, not so much, because you're going to be paying for some of the part of the older one. So it's going to come to an average in the middle there somewhere. So if you're 65, you're going to pay more than pretty much a 65-year old would somewhere else. But if you're 85, you're going to be paying less than an 85-year-old would somewhere else. So it depends on the fairness and how you view that and how it all comes together. But that is what it is in Massachusetts. So we have in Massachusetts, and again, I would still always recommend staying with original Medicare, even though we have a limited choice here. Things are a little more complicated, but we're going to have Plan 1A, which is pretty much Plan G, which gives you 100% coverage with the exception of the Part B deductible. It's going to be a situation where you could change in the middle of the year if we can find a lower carrier price somewhere else, which is great. It's also going to be community rated, so it's pretty easy to know what the rate is. That's what it is. And again, this is what we do. Just give us a call, visit my website. We'll get all that for you. We'll make sure we get the right company from the start, because that's also super important going forward. So we'll put all this together, make it easy. You'll have fantastic coverage. You won't have to worry about it. You'll know exactly what it is going forward. Hope you found this helpful. Have a fantastic day.